investment as so investment in, would you say, the health infrastructure? And also, I was wondering about medical schools. So in regards to training doctors, what are your views on both?
So when we're talking of investment, we're looking at investment both in infrastructure, but also in human resources. And when we're talking of human resources, I think we need to look at it across the board. So doctors, nursing officers, the other healthcare workers, all we need to train, optimize their functioning, and see how they can complement each other. There are areas where you may have a good nurse practitioner, a nurse who's trained well and can be available there to complement the work that a doctor has to do. So how can we develop a strategy in rural India where we can use our healthcare workers optimally? In certain situations, it doesn't always have to be a doctor. We've shown that even if you train ASHA workers to do some healthcare related tasks, they are pretty competent in doing that. So one is to develop a good human resource mechanism, train them well, make sure that they're regularly updated as far as training is concerned, and also support them with infrastructure so that they can utilize their training in a better manner, so that even smaller primary health centers or community centers have the facility to support the training that they've got.
Right. Also, you mentioned telemedicine. So I want to know, will this be the future now? Will telemedicine increase? I mean, we were already sort of using it quite a bit in the metro cities and urban areas. But now, what is the, trend?
So telemedicine has become more and more popular because of the fact that both from the doctor's side and from the patient side, there is this worry of coming to the hospital or coming in close contact with the individuals because of the fear of the spread of infection. So it will be something which can be looked at. But I think we need to look at more beyond teleconsultation, probably look at telehealth, because telehealth is something that you can use various mechanisms like devices to monitor patients and be able to treat them or anticipate a disease or an event which may be happening. All of us now have Fitbits or other devices which we wear around our wrist, which give us a lot of information. But if we could collate that into a simple cost-effective device, which, let's say, a patient with heart disease or a patient with diabetes can wear, and we can then the doctor can monitor his vitals or sugars or his respiratory rate or his, let's say, this pulse on a regular mechanism, then that will, and we have an inbuilt, let's say, alarm system, that will help to pick up a change which is happening, which will alert the doctor that this patient is actually now deteriorating and needs to come in quickly rather than late. That will be very useful, especially in smaller towns in rural India, where we have a resource crunch as far as manpower is concerned. So I think we need to see how we can get technology into the health sector, IT into the health sector, as it has come into various other sectors. That has not happened, and I think COVID-19 has really woken us up to this fact, and we need to really work subsequently to make sure that we can do that. Having said that, it's also important that there is a physical contact. After all, a doctor-patient relationship is also very important. And sometimes there is a lot of reassurance and talking to the patient that makes a big difference. It's often said that medicine is not only a science, it's an art also. And the art of medicine is basically when you're able to talk to your patients, you can, reassure them that they'll get well, give them a little bit of confidence. Very often just talking to the patient makes them feel better. And that is what is also important. And it has to be a mixture of seeing the patient and also using telehealth to help as far as patient care is concerned.
Very true. Very true. You're absolutely right. I mean, talking to a doctor, half the time I feel that I'm absolutely fine the minute I talk to a doctor. But yeah, telemedicine, I think it'll free up the hospitals, right? The very critically ill patients.
Apart from working on pulmonology and sleep disorders, you've come a very long way. What could you tell us about the structure of your journey, sir?
So I did most of my training as far as medicine is concerned in PGI Chandigarh, and I specialized and did a DM in pulmonary and critical care medicine. When I joined the All India Institute of Medical Sciences in '92, I joined in internal medicine, which had pulmonary medicine as a part of internal medicine. And this was a learning experience for me because I learned a lot of medicine as such, which was more than pulmonary medicine, whether it was managing patients with dengue or with other infections. I was involved in all of that. But over a period of time, I realized that we need to really focus a lot on pulmonary medicine because the specialty had grown a lot. There was a lot of interventions and treatment strategies which were required. And that's why we branched from internal medicine to pulmonary medicine and started a DM in pulmonary critical care and sleep medicine at the All India Institute of Medical Sciences. It's been a learning journey for me, both knowledge-wise and experience-wise.
Okay, so you were credited with the establishment for India's first pulmonary medicine and sleep disorders at AIIMS. What would you like to say about that, sir? When did that idea germinate in your mind?
So, like I said, I was the first DM or a doctorate in pulmonary medicine in the country, and then I was in medicine where initially there was a feeling that you have to have a basic training in medicine before you specialize. But I felt over a period of time that we need to have a separate department of pulmonary critical care and sleep medicine. And that's what we started in 2011. It was a tough journey because we had to separate out and set up everything from scratch. But I must say that I'm very happy because in 2015, by an independent survey done by Nielsen, our department was rated the best pulmonary medicine department in the country, and that was for 3 consecutive years. So a lot of hard work, which was very satisfying to develop a new department, develop a new specialty at the All India Institute of Medical Sciences, New Delhi, and start a DM program, which has now become well recognized all over the country.
Okay, so when did you first feel that you wanted to be a doctor? Was it your passion from before?
So my father is also a doctor, so we had medicine that was part of, I could say, my blood, or by as far as what I saw as a child. And therefore, during my time when you have to really decide on your career, I had sort of narrowed it down to either medicine or joining the army. A lot of my uncles are in the armed forces. So it was either to join the army and become an officer in the armed forces or to take up medicine. But I think my parents sort of convinced me to go more towards the medicine side rather than the army side. And I agreed to that, and that's how I'm here, where I am today.
Okay, sir. So you've achieved a lot, but you're very humble. How do you inculcate this humility?
I think when you are a doctor and you see patients and you really are involved in patient care, you realize that there is a lot that you have to be humble to your patients. You have to really reach out to them. And sometimes when you see in the All Institute of Medical Sciences patients who are the poorest of the poor, I've seen patients who come barefooted, they couldn't even afford to have slippers. And then you have to get some samples or get arrange for medicines for them because they can't afford to buy the medicines. When you see all of that, you realize at times how lucky you are to be able to have the things that you have in life. And that is really an humbling experience. So I think we should really count the goods that we have and how lucky we are when we look at people around us. And that makes you truly humble because one feels truly blessed with the type of opportunities God has given one.
Okay, sir. So what motivates you maybe on a daily basis to carry out your duty as a doctor and a director so flawlessly?
So as a director, I feel that I have a huge responsibility. I am at the All India Institute of Medical Sciences, which is rated as the best institute in the country. I feel a huge responsibility to my faculty, to my students, to the staff of the institute, that we have to keep the flag of AIIMS high. We have to be innovative. We have to be there at cutting edge when it comes to research, when it comes to teaching, and when it comes to patient care. We should be able to offer the best to our patients, not only in our country, but what is available across the world. And that is what really drives me as far as the director is concerned. As far as a doctor is concerned, I think it's a very satisfying experience. I enjoy seeing patients. Nothing gives me more happiness than to see the smile on a patient who's become all right, and to see that he's now happy and is relieved. And I think medicine is all about that. The satisfaction that you get by seeing your patients cured and seeing them happy is what gives you the maximum degree of happiness and satisfaction. And that's why you really get sort of involved and become more dedicated to your profession.
Fantastic, sir. Sir, do you feel that because of COVID-19, there is a shift in the mental health of people where there's too much of fear in some people, or anxiety or uncertainty? So, what would you like to say about that?
So I think this is a big problem that we're having, because two or three things have contributed to this. One is that when we talk of COVID-19, we talk a lot of uh, social distancing. It's more of physical distancing. But because of the fear of COVID-19 and the fear of stepping out, the social interactions has become very, very little. People, including doctors, are not going out. There's hardly any traveling. People are not going to restaurants. There's no social parties or interactions. Whatever is done is through the internet or through other means. And sometimes people are not satisfied with that type of a social interaction. Also, there's a lot of fear with the disease. For doctors who are working, I have had residents coming in telling me that what will happen if I get the disease. I'm young, I don't mind, I'm sure I'll become all right, but if I carry it to my parents or to my grandparents, who will look after them? What will happen to them? Those are the fears which are there in the mind of doctors and healthcare workers. And that is why this is a time when there's a lot of stress. And we have been trying very hard to address these mental health issues by our psychologists, the Department of Psychiatry, by trying to see that we have some virtual events where we do some social activities. We did on our institute there was a lot of reluctance to do a culture program. We do a culture program, then we did a virtual culture program. We encouraged all our staff to do some cultural activity and upload it, and then we collated all of that, and with a person who was the master of the ceremony showed it as a culture event which was virtual. But those are the type of things that we need to really encourage for people to de-stress themselves, because otherwise there is a lot of anxiety among healthcare workers related to both the fact that they're not able to socialize and the fact that they have this worry that they may get COVID-19 during work and give it to their near and dear ones.
So, do you feel that you have evolved as a person, as a senior doctor, as a director, with so many patients over the years, handling so many patients? Do you feel you have evolved also, sir?
Definitely, I think I've evolved a lot. I've learned, and like I said, I've become more humble. I've realized how much what medicine is all about, and how from maybe a doctor who comes out as a fresh person who thinks he's bubbling with knowledge, to a doctor who realizes that there's a lot of uncharted areas in medicine that you really need to know about. And that has been a learning experience, that medicine is changing so much. COVID-19 has taught us so much. We knew very little about the virus when it first came. Now we're learning more and more about it every day, and it's throwing up new challenges to us every day. So I think for me, medicine and life, it's a learning experience, and every day is something new to learn and ponder upon, and work on making yourself better as far as that is concerned.
Yes, sir. So, I just wanted to ask you about COVID-19 only. Sir, when do you think this will end? Like, according to your prediction, when do you think this will end?
So it's always dangerous to make predictions, because it depends on how people behave and how the virus behaves, and both are something that one cannot predict. But I feel that there are two parts in this. One part is, when will it become manageable, that we will be able to go back to a near normal situation.
Yes.
That is the situation where we may see in early next year that we would say that now the pandemic is under reasonable control. The cases have come down. They're not gone away, but they can be managed, and with proper COVID appropriate behavior, we could go back to a near normal situation. The second part is, when will the pandemic be over? When will we be able to say that now we've really finished as far as COVID-19 is concerned? That I think will take some more time. It may take even more than a year before we say that we vaccinated everyone and everyone is safe now and the pandemic is over. So that part will take longer, but to really say, let's say, to be closer to normal is possibly early next year.
Okay, so do you feel that we have, like, if we had got to know about this virus a bit earlier and in our country, do you think we would have able to manage this crisis better? Our health infrastructure, everything taken into account. What do you feel, sir?
So this is a difficult question, because retrospectively one can always say that we could have done this better or that better. But I would say that there were a lot of let's say signals from the past 15 years that there is a possibility of a pandemic. We've had outbreaks. We had H1N1 swine flu. We had the Zika outbreak, Ebola outbreak. We had a MERS coronavirus outbreak. So if you start looking at the history of outbreaks and possible potential outbreaks which could have been pandemics, there have been number of such events over the last few years. And therefore, possibly we could have sort of prepared ourselves even before that we may have a pandemic, and we must start having a strategy in place. But that is something that could have been done, because retrospectively could argue there were a lot of warning or red flags over the last decade that a pandemic is inevitable. But I suppose we all felt that it may not happen now, it may happen a few years later.
Okay, so you've been awarded the Padma Shri Award. How did that make you feel as a truly brilliant doctor and a flawless doctor?
So Padma Shri is more of the work for the work that you've done. It didn't make me feel like a truly brilliant doctor. What made me feel good as a doctor is like I said, the satisfaction of seeing patients and seeing them cured. This is more of a award which is by the government recognizing your work. I personally feel that what one should do is work with all sincerity, be true to your work and to your profession, and don't worry about the awards or the gains that you want. They will come on their own, because once if you work sincerely, people will recognize your work and you will get recognition for that. But what is more important is to work sincerely without that thought of that you're doing this to get an award. It's more for your own satisfaction. That is more and more important.
So do you feel that in terms of the health infrastructure, is India being able to do enough for the COVID patients?
So in terms of health infrastructure, we have done a lot. We started off with very little as far as India is concerned, whether it be testing. We were doing very few testing. We didn't have enough labs. Then when it came to the PPEs, there was shortage of PPEs. We were importing a lot of PPEs and N95 masks. There was a worry about ventilators and other supportive things. So in terms of infrastructure, we've been able to really ramp up all of this to a stage where we can export many of these things. So I think we've done a reasonably good job as far as infrastructure is concerned, and especially considering the constraints that we had. But in terms of the public sector, I think there is a lot more to be done, which is what we've learnt about, and I'm sure we will be able to do that in the coming years.
Thank you so much, sir. So I don't have any more questions for you, but I just wanted, if you could please give a message to our viewers about the current times, the times we are facing, and how they should handle it with a positive attitude. And as you spoke about psychology also, so sir, could you just give us a short message for our viewers?
So first of all, I'd like to say that we need to have a very positive attitude. This is a tough phase that the world is going through, and we're also going through this, but we'll come out of it. We've come out of worse situations even in the past. If you look at data from the 1918 pandemic, a large number of people, almost 40 to 50 million people died. Even in India, we had 7 million deaths there, and the population was not that large. So we've come out of this situation in the past, and we will definitely come out of it and come out stronger, because there's a lot of learning that we've had, especially as far as the health sector is concerned. But the other thing that this pandemic has taught us is that how preventive health is very, very important for us as far as disease is concerned. So whether it be hand washing, whether it be maintaining physical distancing, cough etiquettes, wearing a mask, all of this goes a long way, not only to protect us from COVID, but from a lot of other diseases. Waterborne diseases, if we wash our hands, we will not get a lot of diseases which occur because of food and water contamination. If we wear a mask, we will not get respiratory diseases, whether it be influenza, COVID-19, or even tuberculosis. So I think what it has taught us is that if we have a good health behavior, we can help prevent ourselves from large number of diseases. And this is a lesson which many countries in Southeast Asia have learned and are adopting. And we in India can do that, whether it's not spitting and doing things like that. I think it's a time that we all start a movement that we will focus more and more on preventive health, safe drinking water, good cough etiquettes, and physical distancing. If we all do this, we will rapidly bring down the disease burden in our country. And I would just like to appeal to everyone to come forward in this movement of preventive health.
Thank you so much, sir. I'm very grateful that you took out time from your very busy schedule, and we're lucky to have you with us. Thank you so much, sir.
Thank you
sir.
very much.
Very grateful, sir. Thank you.